The things that comprise narcissistic abuse, the behaviors that happen in the relationship, are comprised of the following, okay? The patterns that just sort of diminish us and devalue us, the gaslighting, the domination, the disagreeableness, the betrayal, the deprivation. I'm going to belabor some of these, but not others. I use this acronym because it just makes it easier to remember. Dismissiveness, invalidation, minimization, manipulation, entitlement, and rage. That's what your clients are often going through kind of on a daily basis if they have daily contact with the narcissistic person. It doesn't feel good, and it makes a person feel smaller and smaller and smaller. If a person grew up with this, it really means that self-worth never gets a chance to develop. Shaw does a beautiful job using an object relations model informed by traumatizing narcissism. And he calls the narcissistic relationship the loss of intersubjectivity. Intersubjectivity being the idea that the two of us in a relationship are able to hold space for the other person's experience with respect and love, and not believe that dissent would result in the other person leaving. It's safety, but it's safety and the ability to be ourselves. In a child relationship with a narcissistic person, this never gets to develop. And the caregiver, in his words, the caregiver, the parent, rejects the child ever getting to become their own person or mutually regard that child as their own person. Then that narcissistic parent lets the child internalize parental guilt and parental shame. That's one of the paths of self-blame. Because now the child is internalizing the parental resentment. How dare you have a need from me? Because that's the narcissistic parent's position. And then the child feels, I feel bad. They internalize the parent's resentment because they can't think mom or dad are selfish, okay? The child has to then manage the parent's needs and get rid of their own. Because if they have needs, they'll be resented, and there could then be that subsequent loss of attachment, which is catastrophic. It's always about, again, that maintenance of attachment. And then the child in adult relationships will then start to replicate this cycle again. What do we do as therapists? Our goal is to develop that subjective self. We're doing it as an aftermarket add-on. It should have been done when they were little, but we can do it in therapy. And Shaw does a magnificent job in his first book of talking about therapeutic love. It's some of the most beautiful stuff I've ever read, because to do this work, we have to have love for these clients. And you know what I mean? Again, I mean it in that way that we talk about therapeutic love. That's how subjectivity gets fostered, and that's what we're bringing these clients.